What if I told you that the position you fall asleep in tonight could be quietly setting the stage for a stroke before morning? Most people have no idea this is even a conversation cardiologists are having. But it is. And if you sleep a certain way every single night, the way millions of people do, you need to hear what I'm about to share with you. Hi, I'm Dr. Zoe, and welcome back to Dr. Zoe Health Talks. If you're new here, this channel is all about giving you real, medically grounded information that your body actually needs. Not watered-down advice, not fear-mongering, just the truth. And today's truth is one that I personally think every adult over the age of 30 should know. So if you haven't already, hit that subscribe button, because we talk about things like this all the time. Now let's get right into it. Stroke is one of the leading causes of death and long-term disability worldwide. And when most people think about stroke risk, they think about things like high blood pressure, smoking, obesity, or a family history of heart disease. All of those things matter, absolutely. But what almost nobody talks about is what happens to your body during the 7 or 8 hours you spend completely unconscious, lying in a fixed position, completely unaware of what your cardiovascular system is going through. Your sleeping position is not neutral. It is not passive. It is actively doing something to your body every single night. And for some people, that something is increasing their risk of stroke in ways that are only now being taken seriously by cardiologists and sleep researchers. So let's talk about which position we're actually referring to. The one that raises the most concern is sleeping flat on your back, what's called the supine position. And before you panic, let me explain the mechanism, because once you understand why, everything else makes sense. When you sleep flat on your back, gravity works differently on your airway than it does when you're upright or on your side. The tongue and soft tissues at the back of the throat are more likely to relax and partially collapse the airway. This is the physical foundation of something called obstructive sleep apnea, a condition where your breathing repeatedly stops and starts throughout the night. And here is where the stroke connection becomes very real. Sleep apnea, especially when it goes undiagnosed, does something alarming to your cardiovascular system night after night. Every time your airway partially or fully collapses, your oxygen levels drop. Your brain senses this and it panics. It sends out a distress signal that jolts you just enough to reopen the airway, even if you don't fully wake up. This can happen dozens, sometimes over 100 times per night. Each one of those events causes a spike in your blood pressure. Each one triggers inflammation. Each one puts mechanical stress on your blood vessels and your heart. Over time, months, years, this repeated nocturnal stress is like running a car engine at high revs while it's sitting in the garage. You don't see the damage accumulating, but it's happening. And the research connecting sleep apnea to stroke risk is not subtle. Studies have shown that people with moderate to severe untreated sleep apnea have a significantly elevated risk of stroke compared to those without it. And sleeping on your back dramatically worsens sleep apnea, or in some people, it's the primary trigger that causes it. But it doesn't end with sleep apnea. There's another mechanism worth understanding, and this one applies even to people who don't have a formal sleep apnea diagnosis. When you sleep flat on your back, blood return to the heart from the lower body can change. For people with certain vascular conditions, including those with atherosclerosis, that's plaque buildup in the arteries, changes in blood flow dynamics during sleep can increase the likelihood of a clot forming or traveling. Clots that reach the brain cause ischemic strokes, which make up the vast majority of all strokes. And here's something that makes this even more pressing. Stroke risk is not equal throughout the day. Research has consistently shown that strokes happen more frequently in the early morning hours, roughly between 6 a.m. and noon. Why? Because that's when we're transitioning out of sleep, when blood pressure naturally surges as the body prepares to wake, and when the cardiovascular stresses of a night's worth of poor sleep position converge all at once. This is not a coincidence. This is physiology. Now, I want to be very clear here because I believe in giving you the full picture. Sleeping on your back does not automatically mean you will have a stroke. The risk is conditional. It depends on whether you already have underlying cardiovascular risk factors, whether you have sleep apnea that's undiagnosed or unmanaged, and how long you've been sleeping that way habitually. For a healthy young person with no risk factors, the concern is much lower. But for someone in their 40s, 50s, or 60s, especially with high blood pressure, diabetes, or a history of any cardiovascular issues, this is absolutely a conversation worth having with your doctor. So, what should you actually do with this information? The most protective sleeping position from a cardiovascular and stroke risk standpoint is sleeping on your left side. And cardiologists have been saying this for years, but it often gets buried under generic sleep hygiene advice. Sleeping on your left side improves circulation, reduces the load on your heart, and significantly decreases the likelihood of airway collapse. If you have acid reflux, it also helps with that. If you're pregnant, left side sleeping improves blood flow to the baby. It is, across the board, one of the most beneficial default sleep positions for your overall health. If you're a dedicated back sleeper and changing feels impossible, here's a practical middle ground. Elevating your head by at least 30 to 45 degrees using a wedge pillow or an adjustable bed can reduce the gravitational airway collapse that triggers sleep apnea events. It's not as effective as side sleeping, but it makes a real difference. Some people also use positional therapy, essentially a specially designed device or even a tennis ball sewn into the back of a sleep shirt to discourage rolling onto the back during the night. And please, if you snore loudly, if your partner has ever told you that you stop breathing during sleep, if you wake up with headaches, if you're exhausted despite 8 hours in bed, please get a sleep study done. Sleep apnea is one of the most underdiagnosed conditions in the world, and it is remarkably treatable. CPAP therapy, for example, has been shown in clinical studies to significantly reduce stroke risk in people with sleep apnea. You don't have to just live with it. I also want to say this directly because I think it matters. Stroke is not something that just happens to old people. I've spoken with patients in their 30s who've had strokes, and in many of those cases, when we piece together the picture, the unmanaged blood pressure, the sleep that was never truly restorative, the fatigue they'd normalized, the pattern was there. The warning signs were there. They just didn't know what to look for. That's why this channel exists. Not to scare you, but to arm you. Information is the most powerful preventive medicine there is. So here's what I want you to do right now. Tonight, try sleeping on your left side. Notice how you feel in the morning, whether you wake more rested, whether any usual aches or that familiar morning grogginess feels different. Pay attention to your body. And if you have a partner, ask them to notice whether you snore less or seem to breathe more quietly. These small observations can tell you a lot. If you found this video helpful, please share it, not just for the algorithm, but because someone you know might genuinely need to hear this. A parent, a spouse, a friend who snores every night and thinks it's just one of those things. Sometimes sharing the right video at the right time changes someone's health trajectory. I truly believe that. And before you go, drop a comment below and let me know. What position do you normally sleep in? Are you a back sleeper, a side sleeper, a stomach sleeper? I read every comment and I'd love to know what you think after watching this. Your feedback also helps me decide what to cover next, so please don't be shy. I'm Dr. Zoe, and this has been Dr. Zoe Health Talks. Take care of your heart, take care of your sleep, and I will see you in the next video.